So an ENT doctor, or otolaryngologist, is one that specializes in really the head and neck areas. So anything above the neck, but not the eyes and not the brain. So we treat a lot of allergy, a lot of sinus issues, a lot of hearing and balance issues, as well as what people usually think of as far as tonsils and adenoids and tubes for kids. So when patients first come to see us, the thing I try to keep in mind is they're people. They have worries and concerns. They're usually not feeling well. That's why they're coming to see us as a specialist. They've usually seen one or two other people already. Sometimes they won't verbalize or say what their main concern is. Sometimes you have to pry that out, that they may have a little bump or something that they're worried about, but the real agenda or problem is that, gosh, their brother or uncle had cancer and they don't want to say the C word, but boy, they want to have assurance or relief that they're okay. So complicated problems or complicated issues for patients, I'm certainly very happy to have them come with family members because sometimes they see things that the patient may not have realized or understood. Sometimes having 2 or 3 sets of ears in there to listen and talk and kind of process information and take home and discuss more is very helpful. So I certainly don't mind family members coming in. But we see as ENT, it's a great specialty because we see folks all the way from 80s to 90s for hearing loss, all the way down to newborns for tongue tie, where their tongue can't move very well. We release that right in the clinic. We see a lot of kids for tubes, tonsils, and I think the most rewarding part for ENT is that patients usually do very well. Usually we can pinpoint or find a cause for what is making someone suffer or be in pain. But it's a gratifying field because, again, we see a lot of people get better. A lot of people, we can make a big difference in their lifestyle, especially if they're sinus or allergy sufferers. It's a nice field to work in.